Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
Brad, what's going on here?
Well, I wanted to give some information out to people, our viewers, on someone if they've had a stroke. They're already home, they've recovered at the hospital a fair amount, but they're not 100% recovered. And you find that the person is in a walking mode. They can walk, get up and move around fairly safely. But you find that they're bumping into the wall on one side, and that's very common with the strokes. They call it neglect. Or their gait or their walking, their balance is a little off and they stagger a little bit, and that one leg that's involved doesn't go where it wants to go. And it bumps into things, which puts them at risk for a fall.
Sure.
So this is a nice little exercise. I'm using it right now with a patient. It's really working out well. And what we do is we start from a seated position. And assuming you're using a cane, and you know, if you're good enough where you don't need a cane, you could probably do that too. You gotta use your judgment. But if you're doing that, you should have a gait belt on and have someone helping, because we are challenging the person's balance. Okay, allow me, Bob. I don't want you putting your arms around me in public there. All right.
In public, so I can do it in private?
Oh yeah. No, Bob. I don't go there either. Okay. Here we go. Now. So the gait belt is there, and I think it's good to start in a seated position, because oftentimes these people have problems getting up out of a chair as well.
Sure.
It might be a chair with arms where they need to push, which is real common, or without. In this case, we're going without, and the person's gonna start here and get up and stand just for a little bit and make sure they have their balance. Then,
would I be holding on to you at this point?
probably once we start walking,
Yeah.
I'm gonna demonstrate this so that.
Without me holding on.
Exactly.
Okay.
And you need two things in front on the floor. Now here we have football that's got a purple team called the Vikings there. And then of course we got the Packer representation here, the Green Bay Packers. But you don't, actually I probably wouldn't use balls at home. You might want to just put something that, a visual aid they can see, something that
Sure.
won't break or whatever. And if you step on it, you won't lose your balance.
Sure.
So I would not use balls, but we will here just so we can see it well. And the person's simply going to walk around the objects. So we're turning left, now we're turning right. And if the person has neglect, what you're going to find out is, and this is what happens with the person I'm working with right now, to the left, if we're only looking at this ball, he will go way out here and he's way away from the ball, and I'll say, Jerry, you got to see that ball, and he'll look and he'll say, oh yeah, I didn't notice it. And then he'll correct himself.
Sure.
So you really have to train that mind to,
Start seeing those things.
yeah, that neglect is going to go away if they really work with it. So because of the camera space here, we got it pretty close. I'd probably have the ball about 5 feet and the next one another 5 feet.
Sure.
But we don't have the camera space in the room available. So go ahead, Bob. Go ahead and go. So the person's going to be on the weak side typically, whichever side they tend like they're going to lean towards, and that would be the side they fall. Now you're going to go this way. And a lot of times that leg might swing like this. That's a common gait pattern with a stroke. And then Bob is going to say, turn to your left, watch the spot. Yep. And then we're going to go around, back. And of course the cane, make sure the cane doesn't bump into the object as well, because when you're walking and you bump into the wall or something with the cane, that can be a risk for a fall as
Exactly.
well. So we're minding the cane. So
you want to go both directions, Brad,
right.
basically.
So the first time
Start on the
we're
right,
going,
start instead of the left side.
yeah, this way and the other direction. You can do it without the figure eight just to start out with, and just use one object and
Sure.
get up and walk around both directions.
Sure.
So it's
Yeah.
a really simple technique. Make sure it's safe and make sure you're helping the person. And it may take some time to get that neglect away, and it's not going to happen in 2 or 3 tries. It's probably going to be 10, 20, or easily
You have
more.
to make a daily routine,
Yeah,
probably.
exactly. So very good. Any other?
Well, I just one thought.
Oh, Bob,
I think of the
why?
Packers.
Oh, Bob.
All right, thanks
Take
a
care
lot.
and subscribe. We'll show you more helpful hints just like this in the future.